What is the difference between breast augmentation, breast reconstruction, and breast reduction surgeries?
So whenever the breast is not developed or it is small in size, then we do what is known as breast augmentation. Sometimes there is a completely absent breast on one side.
After taking medicine only, the breast size increases, something like that.
There is only one advice for them.
After the surgery, do the breast looks natural or normal?
So the breastfeeding can be taken normally. The nipple areola should be properly vascular. That time you don't think that अरे उसका शादी होने वाला है, later on there will be scars on the body.
After breastfeeding, some women have larger breast than before.
When the size of the breast is very big, that is when
Namaste. Welcome you all to our new episode of Health Heroes of India. Today, we are going to discuss a very important topic called breast surgery. To learn more about breast surgery, we have invited our guest, Dr. Anjali Saple. Dr. Anjali Saple is a cosmetic and plastic surgeon based in Visakhapatnam with more than 25 years of experience. She has performed many breast surgeries and other cosmetic surgeries across India and helping many people.
Welcome, ma'am. Welcome to our podcast, Health Heroes of India.
Thank you very much.
As today the topic of discussion is awareness about breast surgeries. While discussing about the breast surgeries, few things comes to my mind, and few things basic general people they don't know about what is breast surgeries and when it is required and how it will be taken up.
Right.
So our today's video is regarding this only. We'll discuss thoroughly about this topic, and let's come to the topic and we'll discuss.
Okay.
So, madam, basically in India, awareness is very less about medical health. So right now it's going on, and people's coming more due to this social media or something like that. So, as today breast surgery we are going to discuss. So, could you tell me what is the difference between breast augmentation, breast reconstruction, and breast reduction surgeries?
Okay, breast augmentation is mainly, as the name suggests, augmentation means to increase. So whenever the breast is not developed or it is small in size, then we do what is known as breast augmentation.
Okay.
Breast reconstruction is, suppose the breast has been removed because of certain conditions. Usually it is because of cancer. Sometimes it could be because of tuberculosis of the breast, where part of the breast may get deformed.
Okay.
So in those cases, what we call is breast reconstruction. And breast reduction is when the size of the breast is very big. That is when we need to reduce the size. That is known as breast reduction. There is one more surgery that is also known as breast lift. So that is when the size and volume is okay. But usually this is seen after pregnancy and lactation, where the breast droops down, it starts sagging.
Okay.
So there we can help with a breast lift surgery or mastopexy. So these are the various different types of breast surgeries that can be availed.
Ma'am, in your career time, 25-year experience you have on the field of plastic surgeries. So, have you seen any child who has less developed breast or poor developed breast? What is your suggestion and how they should concern it?
So, there are a lot of people who come where the girls do not have completely developed breasts. The parents are very apprehensive that the size is not adequate. So, when they come at a young age, we only counsel them. We tell them that we have to wait for the child to at least attain puberty and wait for a few more years, because sometimes there may be delayed growth, and we just reassure them at that point in time. It's only after the complete growth of the child's body is over, that is when we offer them any kind of surgical options.
So, what is the particular age?
So usually we wait for at least 17 to 18 years of age for the girl to complete that, because by that time she also realizes what she wants in her body. It is not that we are offering her just because somebody else wants her to go in for surgery. She herself has to be willing. She herself should be wanting that surgery.
Yes, ma'am. Like poor breast, unequal breast size.
Yes.
So, on that case, any kind of recommendation?
Yeah. So in unequal size, sometimes it is like one side is normally developed and one side is very big. So in that case, we have to ask the girl and her parents what size they actually wanted. So if they want to keep the normal breast at that size, then what we do is we reduce the opposite size breast and bring it to the same size as the normal size. But suppose they want to increase the size of the breast, then in that case, it is the surgery is tailored accordingly. So the bigger size will be reduced, and the normal size, if they want it little increase in size, we can put an implant there.
Okay.
Sometimes there is a completely absent breast on one side, which is known as Poland syndrome, in which case again we have to discuss with them. Most of the times these patients will go in for an implant for the undeveloped side.
Okay. And ma'am, is there any kind of thing that after taking medicine only the breast size increases, something like that?
No, that is, see, this is a misconception that many
That's
people, yeah, it's a myth. So many people feel that we can take some Ayurvedic tablets or some kind of medicines and they will, the breast size will increase. And they don't realize that they are actually damaging their body by taking these medications, which have got no effect on breast size.
Okay.
So I would strongly try to put this message across to people that please do not take medicines to either increase or decrease breast size. Medicines do not alter breast size. And please show a doctor, a person who is well qualified to address your breast concerns.
Yes. So it's a myth.
Yeah, that is completely a myth.
So, ma'am, after doing surgeries, you use implants or body tissues. So, which one do you recommend?
So,
and when you recommend?
Regarding the
Surgery.
augmentation, right? So again, that is the patient's side, a patient's choice. So some people, they want a slightly bigger size breast. In that case, usually we advise them to go in for implants. Yeah. For the autologous tissue, we normally use fat, which is harvested from either the abdomen or the thighs. And that fat is processed and it is injected into the breast size. But the thing is that with fat transfer, the size increase may not be as much as what we can give with an implant. Okay. That is number one. Number two, very often these girls do not have that much of fat in the abdomen or in the thighs because they may be very thin built. So in those cases, we cannot use the autologous fat. In those cases, we are compelled to go for implants. But if the lady has adequate fat reserves and she does not want to use implants, in that case, we can use fat from the various other parts of the body. We can suck it through liposuction and inject it into the breast to increase the size of the breast.
Autologous surgeries and implant.
Yes.
Which one is the good?
Again,
as per the body.
So both are safe. As I told you, the indications for both are different. So if there is a girl who desperately wants her breast size to increase, but she does not have any autologous tissue, we'll be forced to use implants. Implants these days are all safe implants. We use all FDA approved implants. So the safety wise, both are safe. The only issue with autologous is that we may need more sittings as compared to implants. Implants is done in one sitting. In autologous fat, when we use fat injections for the breast, because it is autologous tissue, a part of it gets absorbed and the breast size that we have given immediately after the surgery may reduce to a certain extent. So it may need a second sitting to again bring that size back. So that whenever we decide what surgery is to be undertaken, it is always in counseling with the patient, with her parents, with her family. Yes. Very often I counsel them at least 4 to 5 times before they go in for the surgery. And only after I have understood what they want and they have understood what I'm trying to tell them, only then we decide to go in for the surgery.
Ma'am, when you are going for a implant, silicone implant, what are the disadvantages and what are harmful things implant does?
So as I said earlier also, these implants are very safe. They are all FDA approved. So we don't really see too many complications with this, but they are foreign tissues. So sometimes there may be very negligible complications like maybe an infection here and there, or sometimes there may be some tightness around the implants. So these are very, very rare complications that we see once in a while.
Okay. Ma'am, after the surgeries, do the breast looks natural or normal, or any kind of like small or big, something like that?
No.
Sizes?
So once the surgery is done, initially about a month or so, it does look a little different from a normal breast. But as the tissue settles, the implant will settle down in its normal anatomical position, and gradually the breast starts looking and feeling like a natural breast.
Is there
Yes.
any scar after surgery?
The scars are there. There is obviously a scar because we need to cut the skin to insert the implant, but that is almost invisible because we usually put the incision in where the skin creases.
Okay.
So it gets hidden in that skin crease, and over a period of time you can't really see the scar.
Suppose after the surgery, if there will be any kind of breast problems when the woman or child or girls goes to doctor for the breast examination or any kind of evaluations, so will it create any problems?
No, it does not, because you have to understand that when we put the implant, we don't really put it inside the breast tissue. It is always put behind the breast tissue. Behind the breast tissue. Okay. So it is usually put just above the muscle. So between the breast and the muscle, that is where the implant sits.
Okay.
So any kind of breast examination or ultrasound is not interfered by an implant. Okay. So any future, like any detection of any lumps or God forbid any cancers and all that is not really affected by breast implants.
Suppose a girl does the breast augmentation surgery before marriage and after marriage, after baby, breastfeeding is any kind of hindrance in the breastfeeding, or it's
no, that also is not affected because as I said, it is behind the breast, so the breastfeeding can be taken normally. Okay. Usually there is no interference with breastfeeding either.
Madam, this is the part where breast surgery is needed. Are there any kind of non-surgical way of treatment?
So yes, like if there are certain very small augmentations that are required, there is what we have called as breast fillers. So we can use that. It's a office procedure with no downtime. We can use fillers for increasing the size.
Breast filler is different. Breast silicone implant
is different. Yeah, but this is like for very, very small, deformities. It cannot really increase the size of the breast. So certain irregularities or something, if they are there, then these breast fillers can be used.
Ma'am, after implants, how many years it lasts? And is there any surgery needed in future?
So usually these breast implants, they can be left lifelong. Usually there is no issues whatsoever unless the girl or the lady decides to have them removed. Okay. Some people do come back after many years saying that, okay, we don't want these implants, so please remove them. Or they may want them to be exchanged. Suppose they have gotten a certain size and they want the size to be increased. Okay. So in that case, sometimes they come back that please change the size of these implants. I want them slightly bigger. Okay. Very rarely, as I told you, there may be some tightness around the implant. In those cases, we may have to remove the implant and put in a fresh implant. But otherwise, if it is there, they can stay for life. There is no need to remove them or any further surgery is not required.
And just now we completed breast augmentation surgeries. So let us discuss about breast reduction surgery when it is necessary, and a few questions are there. I'll ask one by one. Ma'am, my first question is that some ladies or young girls, those who have big breasts, so they want to go for the reduction. So for them, what is your advice?
So there is only one advice for them. They have to undergo breast reduction surgery, because large breasts is not just for cosmesis. It is also a very problem that causes a lot of medical issues. So these girls and ladies are really very well benefited by breast reduction surgery.
Okay.
So I would strongly recommend that they should go in for breast reduction surgery in any form.
Basically, breast reduction surgery is done by only plastic surgeon or any other surgeons?
No, it is done by plastic surgeons.
Only plastic surgeons?
Yes, because plastic surgeons, we know, see, what is most important in breast is to try and maintain the sensation and the blood supply to the nipple areola complex, because the breast should be able to function as a normal breast.
Yes.
So there should be good sensation. The nipple areola should be properly vascular, and if possible, the lady should be able to breastfeed if it is done before pregnancy.
Yes.
So all these concepts are understood only by a plastic surgeon. So they should get it done by a board certified plastic surgeon who really understands the anatomy of the breast.
Ma'am, could you specify who are the candidates who can go for the breast reduction?
Yeah, so any girl or any lady who is suffering from large breasts is a candidate for breast reduction, because many times what happens is that some parents come to us that, okay, this is a girl, she's unmarried.
Yes.
And how can we undergo breast reduction surgery for her? But they do not understand the emotional turmoil and the psychological turmoil that this girl is facing. I mean, she's not able to go out in society wearing the clothes that she likes. She is not comfortable with her own body. Forget about that, she is not even able to do her normal day-to-day activities. So many times I have seen girls coming to me saying that, ma'am, I have not slept properly for so many nights. Because of the weight on their chests, they are not even able to have a good night's sleep. So what else is the indication for surgery if this is not the indication? So there is that stigma in parents' minds that any breast surgery in my girl will make her unfit for marriage.
Okay.
But that is what we need to explain to them, that this is for her health. It is not for anything else. It is for her health. Only if she is healthy will she be able to fulfill the duties of a married life, isn't it?
Yes. Yes.
And similarly, we also see this in ladies who have post childbirth. So many a times the breast gets enlarged later on in life. So again, these ladies are candidates for breast reduction. Sometimes because of large breasts, the girls have neck pains, shoulder pains. They are, suffering from cervical spondylitis. And what is the reason? They get MRIs and all done. But the main reason is large breasts.
Yes.
The moment we address the large breast, the cervical pain, the shoulder pain, everything is gone. There are some girls who get even upper back and lower back pain because the body posture is changed. There are girls who come with severe infections and rashes on the undersurface of the breast, because the breast is so large that there is there is a lot of friction between the breast and the chest wall, and that causes rashes, skin excoriations. So all these problems they are facing. They are not able to have a good physical life. Suppose I had a lady who was from the Navy, who was a marathon runner.
Okay.
But she was not able to pursue that passion because of large breasts.
Yes.
So it is a problem that is really that affects them psychologically, physically to hey, but psychologically, emotionally, and there's a very
also.
socially.
Yes.
Many of them, they don't want to get married because they do not have that body image, they do not have that confidence about themselves, and it can be addressed by a simple surgery. So definitely I would say that this is a requirement.
I think awareness is much needed.
Yes,
right now.
awareness is needed. We need to make the society aware that this is not a cosmetic problem. It is a physical problem that the girl is facing.
Well, this kind of topic basically we discuss very less.
Yes, it becomes a taboo because they feel that this is a private part of the girl. So I'm really happy that you have come up with this forum where at least the people who are viewing this program can see this and at least spread the word.
Yes, that's the thing. As a medical person, if you guide them or you
Yes.
tell something and spread awareness, they'll come to know.
They
and
will come
they'll,
to know.
like that only the awareness will start.
Right.
And
That is true.
I don't think this thing only girls or families hesitate to take to the doctor.
Exactly.
And they don't know also which doctor they should go for.
True. There are so many girls who have come to me for surgeries without the knowledge of their fathers. Can you imagine? They come with their mothers because at least they are able to convince their mothers that I am facing this problem. And they have come with their mothers, somehow managed to get the money and they come and they don't tell the fathers that I'm going to undergo this surgery.
And it's actually socially also. Society also, I think.
Yes.
It creates problem if they know something like that.
Like this has happened.
But it's a need of
It is
our
a
body.
need. It's just like suppose a girl has appendicitis. She will get appendectomy done. If there is gallbladder stones, they will remove the gallbladder.
Yes.
That time you don't think that अरे उसका शादी होने वाला है. Later on there will be scars on the body.
Yes,
that
yes.
Nobody thinks, no, because that is the need of the hour, that this disease is there, the treatment is surgery.
Yes.
Similarly is this large breast. So this is a need of the hour.
Not only the large breast augmentation also, that is also.
Yes, I agree. Breast augmentation also, because it affects the body image to a large extent. We have seen the girls, immediately their dressing changes, they come with confidence. There is that spring in their step the moment they do this.
Ma'am, just you mentioned about the body posture regarding breast reduction. Could you explain it more?
Yes. See, unknowingly what happens, these girls, when they have large breasts, they try to hunch. When they are walking, when they are sitting, they are hunching. So that affects their generalized body posture. The spine becomes curved where it is supposed to be straight. And that then also, the rest of the body when they are standing, it brings an unnatural pressure on the hips, on the knees, on the ankles. So unknowingly they are creating this problem for them and for themselves. And that in turn, as they age, as they grow, neck and cervical and shoulder pain happens.
Yes.
But later on, also lower backache, knee pains, ankle pains, all this is related to the incorrect body posture that they have because of the large breasts.
I think body biomechanics change. The weight
Totally biomechanics, because you are into biomechanics, you will understand yourself how the total weight bearing of the body changes.
Yes.
Just subconsciously they start walking like that. And the moment you do the surgery, they themselves, you will feel, ma'am, I'm now walking erect. So totally the whole body posture, the spinal curvature, everything changes.
If a lady having big breast, so do you recommend any kind of thing like a diet or exercises, make it reduce? Or
no, as I said, even in the augmentation question, see, breast is really not affected by diet or exercise because it is breast tissue.
Okay.
To a certain extent, if the lady loses weight, the fat in the breast may reduce in size. There may be some reduction, but the breast tissue is not really affected by either diet or exercise. It will only reduce by surgical intervention. Yeah.
After breast reduction, the scar is there. After surgery, scar will be there. Or the scar will be like permanent, or it will be visible, something like that. Or it's visible or permanent.
Yes. So scarring is there because we cannot really have surgery without scars. But as I said again, when a plastic surgeon does it, the plastic surgeons really know how to, make the scar as less visible as possible. But yes, we do counsel the patient and the relatives that there will be scars. Because unlike in breast augmentation, as I told you, we put the scar in the skin crease, so it is almost invisible. But in breast reduction, that is not the case. There is some scarring in breast, but if done by a correct board certified plastic surgeon, the scars are almost invisible. Okay. And later on, they have to follow a scar protocol, which we give them after the surgery, so that the scars become as less visible as possible. So if they follow up with whatever we are telling them, then it's more or less, it really fades. And what I always tell them is that, the benefit that they are getting by reduction, it is really much, much more. It far outweighs the scarring. Yes. So they themselves are not bothered about the scars usually after the surgery, because they are so happy that the weight has gone off from their body.
Before and after, when a young girl come to you with a heavy breast, before and after, what is the psychological impact you have observed?
It's tremendous. The change is just so obvious. Before, when they come, they are all, they are very not confident. They are usually wearing some dupatta around their necks, trying to cover their breast, and they are walking hunched, as I told you. And you should see the way they come after the surgery. The total dressing changes. They will come in their entire body confidence that is there, that they are exuding, is evident even the choice of clothes that they have after the surgery. And I think the maximum number of thank yous and thank you cards that I've got is following breast reduction.
Any patient's story can you share?
So actually that is also there on my website. There was this girl who was a kuchipudi dancer, who after her pregnancy developed these large breasts, and she was not able to give any stage performances. In fact, she has stopped going out because she was saying that I used to feel that everybody just stares at my breasts. So she used to she had stopped going out into society. And when she approached me, we did the surgery, and within, I think, just 1.5 to 2 months, she went back on stage and she shared a video of her stage performance, of her and her daughter's kuchipudi performance. So that is the kind of confidence that she had once this surgery was done.
Means confidence is there.
Yes.
Along with the confidence, he gain his life also, because
Yes.
what she wants to do,
Yes.
what is hobby,
Yes.
she continued that one.
Yes.
That's a good thing.
Yeah. There are so many doctors who I have operated on, and they themselves say that, we could not stand for long hours doing surgeries because of this.
Okay.
And after that, it's totally changed their way.
Ma'am, after pregnancy, after breastfeeding, some women have larger breasts than before.
Yes.
So, for them, any kind of surgeries is there, and what are the advantages?
So that's a very good question. See, you must have heard a very common term. It's known as mommy makeover. Mommy makeover surgeries. So in that, in ladies after pregnancy, it's not just the breast that loses volume. It's also other parts of the body, like especially the abdomen, where there is loose skin. The muscles become lax because of the pregnancy. So what we can do, and there are other parts also that can become loose. So where we tighten all these structures. Okay. So where we can do a abdominoplasty or a tummy tuck, and in addition to that, we can do surgery for the breast. Yes. Now, breast will depend on whether it is increased in size also, or it is just a sagging, as I told you earlier. Yes. So if it is an increase in the size and the lady wants a reduction, then we do breast reduction surgery in addition to the tummy tuck. If she does not want anything to be done for her abdomen and only breast, then breast reduction can be done for her. A breast reduction always includes a breast lift also.
Breast lift?
Yes.
So what is the difference between breast reduction and breast lift?
So a breast lift is when the increase in the size is not there. Okay. The breast is not really heavy in size, but it has started sagging. Okay. there is drooping of the breast, which usually happens after breastfeeding. So the lady, she wants her youthful breast back, the perkiness that was there before her pregnancy. So in those cases, we do a breast lift, where we shape the existing breast and give her a more youthful or a more perkier appearance of the breast. Okay. So that is known as mastopexy or breast lift. So this is a part of mommy makeover, where we can combine the surgeries in one surgery, or we can do it in multiple stages. And
so when after the birth or after the child, when actually, what is the time, exact time when they should come to you?
When the woman is ready for it, actually. Because see, when she has given birth to a baby, she has to give time to the baby and to her family.
Okay.
So once she's finished her breastfeeding, so usually women breastfeed for about 6 months or so. We wait for another 6 months. And then, so probably after a year or so, the lady has, come out of the trauma of pregnancy, of delivery, of her lactation. And she's, her child is more manageable. So it is all the personal choice of the lady. If she feels fit after 6 months, we can do it after 6 months. Usually I tell them that, wait for a year or so, let your body recover from the trauma of pregnancy, delivery, and they should have completed their family. Because if they want to have another kid, then there is no point doing a tummy tuck and they will have another pregnancy. So they should complete their family. They don't want any more kids. At that time, we can go in for this kind of surgery.
Madam, just now we have completed our discussion on breast reduction and breast augmentation. So we have not discussed till yet what is the post-operative care and pre-operative care. Could you explain us about what the how you have to take pre-operative care and post-operative care?
Pre-operative care, usually if the patient is on any kind of medication, we need to see what kind of medications she's taking. So if there is a certain medication that prevents us from doing surgery, then we need to alter that. Like usually clotting medication, anti-clotting medication, usually tell them to stop it for 4-5 days before the surgery. They have to undergo a proper medical test, a full blood workup, and we get a full anesthesia checkup done by our anesthetist. And only once they clear them for surgery, only then we give them a date for surgery. Before that, as I told you, all breast cases, I like to counsel at least 3 to 4 times before we finally decide for the surgery. So breast augmentation, we do the counseling where depending on what size they want, we do the marking. And once we have decided on the size, we have certain sizers in the OPD itself. So we ask them to wear that and see if they are happy with the projection. It's only then that we place the order for the implants. So in that way, what happens is the patient becomes a part of the decision-making process. And then they feel that, okay, even I am a part of this and I have been able to decide what size implants I'm going to get. So that really helps in the bonding between me and the client, and it also helps in the post-operative recovery. Yeah.
Like pre-operative care is completed or?
No, still. So regarding for in breast reduction, we usually tell the patient to, if there is any kind of skin infection, we first treat that. As I told you, there could be some skin infection in very large breasts. So we usually treat that. Once that is done, only then we go in for surgery. Again, we also time the surgeries depending on their period. So usually we don't operate in and around their period's time. So that also has to be taken into consideration. I think more or less this is the pre-operative. Only if they have any kind of medications, then that we see in conversation with our anesthetist.
Okay.
Post-operative is very important because they have undergone a life-changing surgery. If they don't take care of it, then the surgery is of no use.
Yes.
So one important thing that they have to do is wear well supporting compression garments, which are customized as per their size, so that whether we have augmented or whether we have reduced, the breast is supported well. unless that is done, it will start sagging.
Yes.
So that is very, very important. They have to wear that supporting customized bra for at least 6 weeks, after which they can go back to what they are used to wearing. A good post-operative follow-up. So whenever we call them, they have to come for the dressings or whatever is the follow-up that we are prescribing to them. Usually we ask them to avoid any high intensity exercise for at least 4 weeks, because that is the time required for the tissues to settle and heal from inside. So all this high intensity activity and all can be started after about 4 to 6 weeks. And see, now this is a lifestyle surgery, right? So they have to take care of their lifestyle post-operatively. They cannot just, so usually I always tell them that you have invested in yourself. So continue to do it. So dietary, I also give them dietary advice, lifestyle advice, so that, they have a healthy lifestyle and active lifestyle even after the surgery. So these are a few things that we follow, and we always call them back every 3 to 6 months if they are, locally situated. If not, then we can, we have a remote consultation with them. Usually for the first year, I call them every 3 months to just check how everything is healing, give them the scar protocol and all that. And after a year, it's usually not required. Then as and when they want to come.
What is the scar protocol, ma'am? What are the things then you recommend any kind of gel sheet or?
So for the scars, we usually advise creams, which they are supposed to apply 3-4 times a day. Then silicone gel sheets. And very rarely, if they are showing signs of hypertrophy, we may need to give them steroid injections. And laser, you have CO2 laser. So these can be done to reduce the scarring.
What about the insurance policy? So any insurance number?
Yes, medical insurance covers breast reduction.
Okay.
So because it is a medical problem, so most of the breast reductions, if they are covered,
breast augmentation.
No, breast augmentation is not covered. Breast augmentation, but breast reduction is covered by insurance because of all the problems that it causes.
Breast reconstruction?
Breast reconstruction, yes, it is.
Reduction and reconstruction.
Yes,
both follows.
Both can be covered under insurance.
Ma'am, nowadays many women they lost breast due to mastectomy, breast cancer. So after mastectomy, is there any possibilities to for reconstructions or any kind of?
Definitely. So we can do breast reconstruction following mastectomy. It could be immediate, even at the time of surgery, or delayed. But this option is definitely there. And unfortunately, this awareness is lacking in our country.
Yes.
That we can reconstruct the breast from either body tissues or implants. This definitely, we need to spread this awareness, because ladies who have undergone mastectomy following breast cancer need not feel incomplete.
Yes.
There is an option by which they can avail of completing their completing their recovery journey, because this, I say, is a part of recovery from breast cancer.
Yes. So when do you recommend after mastectomy, when they should come to you for or come to the plastic surgeon for the reconstruction?
Ideally before the surgery.
Before the surgery?
Yes. Ideally, it should be a combined counseling between the oncosurgeon, the breast cancer surgeon who's going to be excising the tumor, the patient, and the plastic surgeon. Okay. So there should be usually a pre-operative counseling should be done, because that is when we will realize what is the patient's requirement, what is her idea of breast reconstruction, whether she wants an immediate breast reconstruction or she wants it delayed. Or again, that will be decided by the oncosurgeon. If the oncosurgeon feels that the breast reconstruction can be done at the same time as the mastectomy, then that can be done. If the oncosurgeon feels that no, it is better to delay it, then again that can be done. So all this can be discussed if the patient comes to us pre-operatively.
Okay, then it's a kind of a team discussion. Then
Yes.
only we'll come to know when, depending on the prognosis, I think.
Yes, depending on what the prognosis is. If the
Yes.
oncosurgeon feels that no, this is better that it is delayed,
Yes.
then we can delay it.
Hmm.
But if it is a low stage and a low grade tumor, then we can give the option to the patient even pre-operatively.
And before that, before the surgery, if the patient also come to know about this
Yes.
reconstruction surgery, there will be hope, I think.
Yeah, there will be hope. There will be more, I think it will be an informed decision made by them. And yeah, they will be more optimistic going in for the surgery.
Ma'am, after the breast reconstruction, as you told just now, so what are the different types of options available for the reconstruction?
Yeah, so depending on what is the size of the opposite breast or the contralateral breast, we have multiple options. Suppose the opposite breast, the patient wants to address the opposite breast. If it is too large, then we may have to reduce the opposite breast and reconstruct the breast that has been removed following cancer.
Okay.
Or, so again, if it's a small size breast that we need to reconstruct, we can use the muscle from the back, that is the latissimus dorsi. Then there is a surgery which is called as DF flap, where we use tissue from the abdomen. So in that, the patient also gets a tummy tuck because we are removing the tissue from the abdomen, and that is shaped to form the breast. This is a microvascular surgery. It takes a little longer as compared to the other surgeries, but it is very, very effective. So even large breasts can be constructed with this. We can use tissue from the thigh, from the buttocks. Okay. So all these various options are there depending on what is the patient's preference. Because if she doesn't want anything to be done from the legs, then we can take from the abdomen and construct the breast. Other option is using implants, like what we use for breast augmentation for cosmetic reasons. Same thing we can use for breast reconstruction.
Okay. The two things.
Yes.
It's in the autologous and
implants. Yes.
What are the emotional support or counseling do you recommend for the patients and his family members? Because family members plays an important role when a patient undergone any kind of cancers or any kind of big problems.
Surgery, yeah. So definitely emotional counseling plays a very important role because the word cancer itself makes it very scary for the patient and her relatives. So that is why I said that a plastic surgeon needs to be involved in the pre-operative counseling of the patient. Because cancer is one aspect. We are going to remove the cancer. But when the lady has breast cancer, either a part of her breast or whole of the breast is going to be removed. And she is always feeling that she may not be complete after the surgery.
Yes.
So we need to impress upon her that there are reconstructive options available. Once your cancer is removed, there are multiple options that are available which you can choose from so that you do not feel incomplete.
Yes.
Like you have a cancer of the mouth. We don't just remove the cancer, we also reconstruct it. Yes. So the same thing applies to breast cancer as well. And through the entire recovery process where they are undergoing radiotherapy, chemotherapy, nowadays there are a lot of specialists who are there for emotional counseling. But other than that, I think the treating doctors and the family plays a very, very important role in the rehabilitation of the patient. And the way the family brings her up, responds to her surgery and her post-operative follow-up, I think that plays a very important role in her, even in the prognosis. I have seen women who have familial support, they are more positive, and even the result of surgery somehow is better. I don't know how that works, but whether it is the positivity of the patient that makes the doctor's surgery heal better or what it is, I cannot explain. But it definitely plays a role.
Yes, emotionally, patient feels emotionally positive means definitely you will be
yes,
living his aspiration for living.
Yeah,
I think it will be more
correct,
and that helps.
Yeah. So the Not only the patient, the family's involvement in the entire process.
Yes.
That is very important, I feel.
How does nipple reconstruction work? And can it be done at the time of breast reconstruction?
So nipple reconstruction, basically it works so that the whole aim is to give the woman a normal looking breast. So we just put a mound of tissues. She still does not feel that it is normal. So there is a process of nipple reconstruction, but that is usually not done at the same time. It is done once the tissues settle down. And then we can also reconstruct the areola either by a surgical option or we can tattoo it. So she gets that areola and the nipple. So that gives her a appearance of a normal breast.
Okay. So this is after the surgery?
After, we have to wait for at least 3 to 6 months before we do the nipple reconstruction surgery.
Okay.
Once the breast reconstruction is done, then we wait for about 3 to 6 months and then we can do the nipple reconstruction.
Thank you, madam, for joining podcast of Health Heroes of India. So today we have discussed a lot thing about breast reduction, breast reconstruction and breast augmentation. Ma'am, could you share some advice that you should give to each and individuals, every girls, every women of our society?
So I feel that as women, we are the nurturers of society. We have responsibility of taking care of our children, our families. So unless we take care of our own health, we will not be able to take care of our families. So I would strongly suggest that we make ourselves our priority. We take care of our health, our lifestyle, and anything that is necessary to bring back our confidence, I think we should accept that.
Yes.
So we should not limit ourselves. That is what I would like to tell people. And one important message that I would like to give the families, that listen to your girl children. If she is suffering, if she is saying that she is suffering from something, give her an ear at least. And if you are not capable of understanding what she wants, then get her to the right person. Yes. So that she is, she gets the solution that she has been wanting. Her life should not be led by you. Her life should be led by herself. She should have that freedom to do what she wants. So don't, cage her. Once she has that kind of freedom, that is when our society will flourish. That's what I feel.
Thank you, ma'am. Thank you for joining our podcast.
Thank you very much. Thank you for having me here.
Thank you.
Thank you.